Hi, I'm Dr. Shea Stark with Pro Chiropractic, and today I want to demonstrate to you flossing of the elbow. Now, I know it sounds funny because most of the time you want to floss your teeth, but this is a different kind of floss. What we're using is a rubber band type material in a wide strap that we're going to wrap around a joint to help loosen up the tissues by actually compressing them together. So what we do here is when we wrap the floss around the joint, it pushes the tissues together and creates a compressive force. And then we can move through that. And once we relieve the tension, it decompresses that tissue and allows it to move a lot easier. So we're going to demonstrate that today on Shannon here. Shannon was in a car accident several months ago and sustained right elbow injury. And so we're still having some lingering issues with this elbow. And so we're going to work on loosening up that tissue right now. So as we start the floss, you're going to start distal or down closer to the hand, away from the body. And so the first wrap you're going to do is just a loose wrap to get a little bit of catch into the next row. And then we start going tight. Now you might experience some numbness or tingling in the fingers. That's completely normal. And we're just going to wrap up, continuing to tighten with each wrap up and over the joint. Good. You want to make sure you continue to check in with the patient to make sure that they're not experiencing too much numbness and tingling in the fingers, as that can cause damage long term. You still doing okay? Wiggle those fingers for me. Perfect. All right, as you get to the end of your roll, you're just going to loosen that top strap and tuck it into the one below it so that you have a nice secure seal there. So once we have the floss on, what we're going to do is work through different movements. So we're going to do some passive range of motion, like elbow flexion into elbow extension, 3 to 5 times. Okay? That helps with the tissues around the elbow. Then we'll work into pronation and supination. Good. Just rotating that wrist down and up. Again, 3 to 5 times. And then I'm going to ask Shannon to do some active motion where she moves on her own. Good, so just gonna, good. Extension is where she has most of her pain, so we're just gonna slowly work into that pain-causing motion. Good job, how's that feeling? Good, perfect. Okay, now the last thing we can do with the floss on here is we can do a little bit, let me tighten that, what's coming off here. Good. Perfect. So the last thing we're gonna do is add a little bit of shear or opposite movement into the tissue. So we're going to start down into the forearm, and we're just going to go back. So I'm going backwards with my right hand and forward with my left hand. So we're just creating a shearing force through those tissues, and we're going to work our way all the way up the elbow. And then we're going to go opposite on the way back. Good. Perfect. Just working through that tension. And then we're going to start and do a little bit more right in the area of the most of her pain. Good. Awesome. Now, when it comes to take the floss off, this is the most fun part. You grab the end, and then you're just gonna kind of unwrap it all the way to the bottom, okay? Awesome. All right, so that was a demonstration of how to floss for elbow pain. If you have any questions or would like to learn more information, please visit our website at www.prochiromt.com. And again, I'm Dr. Stark. Thank you for watching.